As a physician who's spent decades caring for individuals across all stages of life, I believe deeply in the power of knowledge, especially when it comes to understanding our own bodies. One of the most pivotal moments in a woman's monthly cycle is ovulation. And yet, many women don't fully realize just how much this short window can influence their overall well-being. Ovulation is more than just a marker of fertility. It's a sensitive and dynamic phase that brings about a range of physical and emotional changes. From subtle shifts in mood and body temperature to noticeable changes in cervical mucus, the body sends out clear signals when an egg is released. These are important clues, not only for those trying to conceive, but for anyone who wants to better understand their hormonal rhythms. By becoming more in tune with these signs, women can take empowered steps toward improved health, fertility awareness, and personal well-being. Knowledge truly is the first step to taking control of your health at every age. If you found this information helpful, I encourage you to like and share this video so more women and families can benefit from a better understanding of the female reproductive cycle. Your support helps others stay informed and healthy. Now that we've touched on the importance of understanding ovulation, let's take a closer look at when it actually happens. Timing of ovulation. For women with menstrual cycles that last between 28 to 32 days, ovulation usually occurs somewhere between day 11 and day 21 of the cycle. This window is considered the most fertile period, when the chances of conception are highest. What drives this process is a natural surge in a hormone called luteinizing hormone, or LH. This sudden rise in LH signals the ovary to release a mature egg, what we know as ovulation. It's a finely tuned biological event, and understanding its timing can make all the difference when it comes to fertility planning or simply being more aware of your hormonal health. Let's continue by exploring how the body gives us signs that ovulation is near, and how these changes can guide us in understanding fertilities more clearly, cervical mucus, and fertility. One of the most noticeable and informative signs of approaching ovulation is the change in cervical mucus. As ovulation nears, your body naturally prepares for the possibility of conception. The cervix begins producing more mucus, and its texture, color, and consistency become key indicators of fertility. When mucus is scarce or sticky, fertility is generally low. As the cycle progresses, mucus may appear creamy or white, suggesting a rising level of fertility. At peak fertility, just before and during ovulation, the mucus resembles raw egg whites, clear, stretchy, and slippery. This type of mucus helps sperm travel more easily through the cervix to reach the egg. For women who are tracking their cycles, paying close attention to cervical mucus can be a natural and effective way to identify their most fertile days. Ovulation pain. While many women go through ovulation without any noticeable discomfort, a number of women experience what's known as Mittelschmerz, a German word meaning middle pain. This is a mild, sharp, or cramping sensation that typically occurs on one side of the lower abdomen, depending on which ovary is releasing an egg that cycle. This discomfort happens when the follicle ruptures to release the egg. As the follicle breaks, it may release a small amount of fluid or blood, which can irritate nearby tissues and cause pain. It usually lasts just a few minutes to a few hours, and for most women, it's manageable without treatment. If you do notice this pattern regularly around the middle of your cycle, it could be a helpful, natural sign that you're ovulating. However, if the pain becomes severe or persistent, it's important to speak with your healthcare provider to rule out other causes. Let's now explore a key factor in fertility that many don't realize: the very limited time an egg is viable, especially compared to sperm. Lifespan of the egg and sperm. A woman is born with approximately 1 to 2 million eggs, but throughout her reproductive years, only about 300 to 400 of those will actually be released during ovulation. Typically, just one egg is released per cycle, and once it is released, time becomes a critical factor. The egg's lifespan is extremely short. It survives for only 6 to 12 hours after ovulation. That's a very narrow window for fertilization to occur. In contrast, sperm are much more durable. Once inside a woman's reproductive tract, healthy sperm can live for 3 to 5 days under favorable conditions. This is why timing intercourse before ovulation, rather than after, is essential when trying to conceive. Ideally, sperm should already be present and ready to meet the egg when it's released. Understanding this difference in lifespan is key to planning fertility strategies more effectively. It also underscores just how precise and amazing the reproductive system really is. Body temperature and hormones. After ovulation, your body undergoes a hormonal shift that can be detected through a slight rise in basal body temperature, BBT. That's your body's temperature at rest. Here's how it works. Just after the egg is released, the hormone progesterone is secreted by the ovary. Progesterone causes your body temperature to rise by about 0.5 to 1 degree Fahrenheit, around 0.3 to 0.6 degrees. This increase remains until your next period begins. While the temperature rise is small, it's consistent and measurable. Women who are trying to track ovulation can use a basal thermometer each morning before getting out of bed to detect this subtle change. Over time, charting your BBT can help identify your ovulation pattern. It's important to note, this temperature shift happens after ovulation, so it's most useful when observed over several cycles to predict future fertility windows. Behavioral and physical changes. It may come as a surprise, but during the ovulation phase, many women experience noticeable shifts in their appearance, behavior, and emotions, all driven by hormonal changes, particularly the rise in estrogen. Here are some scientifically observed changes. Facial features may appear more attractive due to subtle hormonal effects on skin tone and symmetry. The voice pitch often becomes slightly higher, which researchers believe may unconsciously signal fertility to potential partners. Sexual desire tends to increase, usually a few days before ovulation. This natural rise in libido is closely linked to estrogen peaks. Many women also report improved mood, confidence, and energy during this fertile window. These changes are nature's way of supporting reproductive success, even if we're not consciously aware of them. For women tracking their cycle, not just for conception, but for self-awareness, these cues can be incredibly insightful. Understanding how your body communicates these signals helps you feel more in control of your health, relationships, and emotional well-being. Ovulation is much more than just a step toward conception. It's a powerful indicator of overall health. This brief but vital phase in the menstrual cycle influences not only fertility, but also a woman's mood, energy, physical appearance, and body temperature. By paying close attention to signs such as cervical mucus consistency, mild abdominal pain, and slight shifts in basal body temperature, women can gain valuable insights into their hormonal rhythms. Whether you're planning for pregnancy or simply aiming to better understand your body, these natural cues can be incredibly helpful. As a physician, I always encourage my patients to become partners in their own health, and understanding ovulation is a smart, empowering place to start. If you found this information helpful, please consider liking and sharing this video with others who might benefit. And don't forget to subscribe to stay updated on reliable, science-backed health content that truly supports your well-being.